Okay, good afternoon. I'd like to welcome everyone to the fifth meeting of the Health Services Committee. It looks like we have everyone kind of rolling in, so I'm going to go ahead and have DJ take the roll and call the meeting to order.
Representative Bentley, Representative Bratcher,
Here.
Representative Bray, Representative Burke, Representative Callaway,
Present.
Representative Camuel,
Here.
Representative Duval,
Here.
Representative Frazier Gordon, Representative Justice, Representative Neighbors,
Here.
Representative Rayburn, Representative Raymer,
Here.
Representative Riley, Representative Rourks, Representative Sharp,
Present.
Representative Wilner, Representative Whidden, Vice Chair Dotson,
Here.
Chair Mosier.
I am here. Okay, we have a quorum established to do business, and we are meeting at the same time as state government, so we may have some members who are coming back and forth. I will make my way to the table to discuss House Bill 293. Oh, actually, you know what? I think first we're going to do the regs. My apologies. We have some regs that are to be considered by this committee. Everyone should have received a copy and hyperlink to the regs. Are there any questions about any of the regulations? Okay. Seeing none, I will consider those reviewed. All right. And so now I will make my way to the table and hand the gavel to my Vice Chair, Dotson.
As we're getting ready to hear House Bill 293, we do have a committee sub on this measure. I got a motion on the sub. I got a second. It's Representative Callaway. All right. Introduce yourself for the record, and you may proceed.
Okay, thank you. So the committee sub is adopted?
Yes.
Okay, wonderful. All right, I am State Representative Kim Mosier from the 64th District, and I appreciate the opportunity to discuss this regulation of Kratom bill, House Bill 293. We've talked about this in the interim, so most members should be familiar, but I'll just kind of do a recap. And first, I think you've seen the original bill. Everyone got the committee sub yesterday. And what that does is we originally had the regulation of this product under ABC with some licensure requirements, and we decided to move that over to DPH, put it under DPH, and remove the licensure requirements but leave in the fines and the fees. DPH is where we put the Delta 8 regulation last year, and they are doing a great job with that. So we just wanted to make sure that there was some enforcement, and so that's the change in the committee sub. So Kratom is a natural herbal supplement. It's currently being sold in Kentucky without any sort of regulations. It's very similar to a bill that we passed last year, House Bill 569, or in 2022. And so what is Kratom? Kratom is, as I said, a natural herbal supplement, Mitragina speciosa, which some people report using for anxiety, pain, even PTSD. The active ingredient in Kratom comes from the coffee tree. So some users of the drug report positive results, but it can also be abused, and it causes euphoric effects, reportedly similar to heroin in some people. Kratom has an addictive potential, and it should not be available to children under or youth under the age of 21. In 2022, we again heard testimony from Kentuckians who reported some positive results, but we also heard from Kentuckians who had some pretty grave concerns. And so that's really where this comes from. This bill will regulate the sale of kratom, and it's a Consumer Protection Act. It does not really take a position on the positive versus negative effects. We just want to make sure that this is regulated while the FDA weighs in on this. As I said, we took similar action on Delta 8 last year, and so it's going well, so we will have it live in the same space as the Delta 8 regulations. So what House Bill 293 does is it defines kratom in statute. It puts kratom behind the counter and makes the sale of kratom to those under 21 illegal. There are some states such as Florida, Georgia, Texas, and Virginia that have passed similar bills to House Bill 293, and some other states that are considering similar language. There has also been legislation in previous sessions of the Kentucky General Assembly that would have banned kratom, but there really wasn't the support to do that. This bill is a compromise. It allows those wishing to use kratom to do so, but with some consumer protections and an age restriction that just keeps children from buying this. I have a guest with me who I would like you to introduce yourself for the record, and if you have a statement or we're just available for questions, go ahead.
Okay.
Thank you.
Thank you
for being here.
Members of the House Health Services Committee, thank you for allowing me to testify for you today. My name is Todd Kelly. I'm the Chief of Police of Ashland. I became a law enforcement officer in 1987 and was named Chief in 2016. I'm also a board member of the Kentucky Association of Chiefs of Police, also known as the KACP. The KACP wholeheartedly supports this House Bill 293. Our organization believes that kratom should be highly regulated. Companies that produce and sell kratom make claims that it can cure opioid addiction and withdrawal symptoms. It can also treat pain, depression, anxiety, cancer, and more. Yet none of these claims have been proven. In fact, the U.S. Food and Drug Administration has issued numerous warnings about the serious risks associated with the use of kratom. Citizens also use kratom with other substances, which that mixture can be highly dangerous. The federal government is saying that not only does kratom not treat illnesses or symptoms, but it can actually cause harm to those who use it. Yet despite these warnings, the federal government has not regulated kratom, which is why the Kentucky General Assembly needs to take action. The KACP applauds the sponsors of this important bill, Representative Kim Moser and Representative Josh Callaway. They are doing what we as law enforcement are doing every day, is trying to protect our citizens across this great state. The KACP urges this esteemed committee and the bill House and the Kentucky House of Representatives to approve this House Bill 293. Doing so will make our state a safer place to live and provide our citizens with a chance at a better quality of life. Thank you. Take any questions.
Before I got ahead of myself just a little bit while ago, we had a first and a second on the committee sub, but we need to officially adopt it. All in favor of the committee sub, please say aye. All opposed? We do. I got a motion on the bill as amended by the sub. I do have one question. Representative Bentley.
Not really a question, but a comment on this medication that we so-call. If you go to an emergency room and you're having an overdose with this product, it's not a product, it's an alkaloid. You know how they would treat you? The public needs to know. They'd use Narcan on you, same as an opioid overdose. So thank you for bringing this bill forward, and thank Representative Callaway for his efforts too. And thank you, Police Chief. I know you from up home. Thank you. Thank you, Mr. Chairman.
Any other questions? We have a motion on the bill. Representative Callaway, I'm so sorry.
It's okay. Thank you, Chairman. I just had a question, and I do appreciate your work on the bill, Chair Moser, and we had a discussion yesterday, and I appreciate the changes that are made in the committee sub. I want to clarify, when we use words like it's dangerous and warnings and and even overdose. And I just want to be clear, are there recorded cases of overdoses of kratom within our state? And are there indicators? What are we saying when we say dangerous and interacting with other drugs? There was just a lot. And so I just wanted to know kind of some of the research behind it and what's been documented about it so far. Thank you.
Thank you for that question. And there are cases of overdoses, and certainly polysubstance use is real, and it's a big problem. I think that we wouldn't necessarily know that without autopsy reports, autopsy results, and it does show up in some of the autopsies of drug overdoses. So it's not necessarily the causative agent, but the mixture is dangerous. So I think the labeling piece of the legislation will help folks understand what they're taking, and if they're taking it and it's helping them, hopefully they won't abuse it. Of course, anything can be abused, and we've seen that. So the intent of this really is to keep it away from kids, and just not put it front and center when you go into a gas station or a convenience market and see, a floor-to-ceiling display of this, and it sends the message that this is safe. And if it's behind the counter and a little more difficult to get, then I think it'll certainly decrease the use in kids.
Representative Bentley?
If Chair Lady would let me, I want to make a technical comment.
Yes.
Kratom is metabolized in the liver by the cytochrome P450 systems, 3A4, 2D6, 1A2. Therefore, you have many drug interactions with it. And if you're using it with a sedative, you're asking for trouble. Clonidine even causes a problem with it, which is a adrenergic antagonist, catapress, which we use for drug remedies like cocaine. So technically, she is right, and that's the answer for you. Is the cytochrome P450 system is involved, and it's metabolized in the urine.
Thank you. Seeing no more questions, I have a motion and a second on the bill. DJ, would you please call the roll?
Representative Bentley? Yes. Representative Bratcher?
Yes.
Representative Bray? Yes. Representative Burke?
Yes.
Representative Callaway?
Yes.
Representative Camuel?
Yes.
Representative Dotson?
Yes.
Representative Duval?
Yes.
Representative Fraser Gordon? Yes. Representative Justice? Representative Neighbors?
Yes.
Representative Rayburn? Representative Raymer?
Yes.
Representative Riley? Representative Rourks?
Yes.
Representative Sharp?
Aye.
Representative Wilner?
Yes.
Representative Whidden? Chair Mosier?
Yes.
We have a unanimous vote, but we also have a title amendment to adopt as well. I do have a motion with Representative Bray, and Representative Raymer was our second. All in favor say aye. All who oppose, title amendment is adopted. Thank you, Representative. Didn't have to use my gavel. You got a question? Oh, okay. He got you.
Oh, that's right. Okay. Yeah. Okay. Next, we will hear House Bill 493. Okay. Representative Bratcher, you have already made your way to the table. I appreciate that. So if you could just introduce yourself for the record, have your guest introduce herself for the record, and please proceed.
Representative Steve Bratcher with 25th District. Thank you. I'm Lisa Biddlepuffer. I am the Director of Quality and Regulatory Affairs for the Kentucky Association of Healthcare Facilities and the Kentucky Center for Assisted Living. I am here actually to thank you so much, Madam Chair, for bringing this to the committee, and a special thanks to Representative Bratcher and Representative Neighbors for sponsoring House Bill 493. This bill is important because what it's doing is it's intending to do the right thing to address some unintended consequences from previous legislation. And that legislation actually goes back to 2022 during the legislation session when Senate Bill 11 passed to modernize assisted living. The other goal was to minimize consumer confusion between assisted living and personal care homes. These personal care homes that are apartment-style personal care homes were to convert to assisted living communities. Frankly, they've been serving the same clientele. The major difference really is that assisted living has been functioning within a social model, and personal care has been able to provide basic health services, including medication administration. Last session, the General Assembly passed Senate Bill 110 and Senate Bill 111 to address medication administration in assisted living. And that's something that is terrific for assisted living, and frankly, you all made it terrific as well by adding the term long-term care facilities, which helps nursing homes who have been suffering the biggest crisis among all healthcare providers with this workforce crisis.
Motion on the bill.
Okay, we have a motion and a second on the bill. Are there any questions? Okay, seeing none, DJ, please take the roll.
Representative Bentley? Yes. Representative Bratcher?
Yes.
Representative Bray? Yes. Representative Burke?
Yes.
Representative Callaway?
Yes.
Representative Camuel?
Yes.
Representative Dotson?
Yes.
Representative Duval?
Yes.
Representative Frazier Gordon? Representative Justice? Representative Neighbors?
Yes.
Representative Rayburn? Representative Raymer?
Yes.
Representative Riley? Representative Rourke?
Yes.
Representative Sharp?
Aye.
Representative Wilner?
Yes.
Representative Whitten? Chair Mosier?
Yes. Okay. House Bill 493 passes with favorable expression, and I should have given you an opportunity, Representative Bratcher, to make any comments. Is there anything that you'd like to say?
Not after the motion, no.
Okay, well, thank you so much for that outstanding presentation. Thank you. Yeah. All right. Having no further business, I will entertain a motion for adjournment. We already did. Okay. We are adjourned.